is Dr. Lashin. I used to work as a GI and liver specialist for 18 years before I get interested in integrative medicine. I had a master's degree and PhD in gastroenterology, hepatology, gut problems, infectious disease, tropical medicine, and many others. I have been seeing a lot of patients, hundreds and hundreds, in the last 32 years since I graduated, and my main focus and interest is to fix a gut which I know is connected in so many ways to the body. Today I'll be talking about GERD, which we hear all the time as a complaint for many patients. Those who have a problem with heartburn or regurg of the acid or acid reflux or GERD will always suffer with every bite, and even when they are not eating at all. So how important this problem is? Very important. That's why we're going to discuss it today. A lot of people have a problem with heartburn, and most of them, they just go to the over-counter medications and keep taking them without thinking where the root problem is. Why do we have increased acidity in the stomach? It's a thing that we need to get to the root of, not just put a band-aid with a PPI or some medications or Tums or similars which you keep taking from over the counter, simply because there is a reason for the stomach telling you, oh, I am producing high HCl because I'm disturbed of something. What would that be? It can be an H. pylori or an infection that is very common to happen in certain places in the world. If you travel for leisure or you travel for work, might happen and you might not know. And the condition can continue to be there for a long time. It is a chronic bacteria, lives in the stomach, loves to live there, can have a home for years without you knowing and without us detecting it if you don't complain or come to the doctor. So H. pylori is one of the things that can be detected either by a breath test called carbon 13 breath test, or H. pylori breath test, or can be detected in blood for an antigen, which is not the best one. Stool antigen can be a good one, and the gold standard will always be an endoscope or an EGD, from which you can get a biopsy from the stomach and check for it. Treatment is an extensive 3-course, 2 weeks treatment in the classic medicine. Yet in integrative medicine, we do things a bit differently. The treatment can be a combination of adjustments of so many other factors. Alkalinizing the stomach can help you with the acidity. It also helps the whole body. So keeping your body in alkaline state can decrease inflammation, can deactivate the bacteria, and can help you to protect yourself from cancers as well. Infections in general, like the acidic milieu, when you change it to alkaline, it causes the body to be much in a safer situation regarding the infections. The GERD can happen also for so many other reasons. It can be an anatomical problem, like regurg from hiatus hernia, regurg because your lower sphincter of the esophagus that has to keep the acid in the stomach became loosed up, and then the acidity can go up, especially if you lie down or you eat a heavy meal. Some types of food can increase acidity, like black pepper specifically, fatty meals, peppermint or mint, and chocolates, and of course coffee. This combination of things together is enough to give you an excessive acidity that can disturb you. Some people can complain of dry hives, some people complain of tasting the acidity in the body. There is many things that you can do to protect yourself from GERD. First of all, as we mentioned, the alkalinity to the body, or drink alkaline water or alkalinize your body using a supplement to do so. Baking soda on water, or even a squeeze of lemon, which seems to be you would think it's a controversial thing. It's actually inducing the bicarb to be induced in the body and produced to neutralize the acidity. One of the things that you can do early morning when you wake up and is good for your body. Eating the food which does not increase the acidity. Dairy products, by the way, is considered a heavy protein meal. For those who are susceptible, the acidity can increase drastically after dairy products ingestion. There is many things that we need to consider to make sure that the acidity is not because of other causes as well, like a small tumor that is producing a lot of acidity due to its nature, or there is a gallbladder or pancreatic problem that is rendering the food to be undigested, and consequently the stomach to try and compensate by adding more gastric juice and increasing the burden of the acidity in the stomach. All in all, GERD is a very common problem. Regretfully, a lot of people try to self-medicate for years. I had patients coming to me after 12 or 15 years on PPIs or Prilosec, or taking some of the Tums or whatever is there over the counter available for them, without searching for the root problem. By the way, any medicine you put in your stomach can also aggravate the problem by disturbing the gut microbiomes or flora, and this can add to the problem, adding weight, increase bloating, decrease in the immunity, inability to absorb food well, inability to use the food well. All this can lead to ill health, multiple problems, and a sequence of events that you wouldn't like. Specifically, that the fixation of a simple problem like this can happen in a more educative way and professional manner if you seek the doctor's advice. In conclusion, if you have any of the symptoms that we have discussed today, it would be my pleasure to talk to you more about it. If you have any comments or questions, please feel free to leave a comment down below. Thank you so much.